equitable access to health facilities. So you realize from also those in rural areas, they suffer a lot because they may not have access to health facilities, though they need. Rural areas, they may be adequate, but there may be other challenges like um, skills and a few other things. There's also shortage of medical personnel who are trained to handle such things. In addition, when talk about the cost involved or in managing such things, the cost is normally high. The cost of surgery is normally high, and the national health insurance does not fully cover the cost of such surgeries. People have to go out of pocket payments for such medical expenses. Some of the drugs that are used to shrink, so to say, are very expensive. The surgery is also expensive. When it comes to complications such as infertility, the investigations, medication, other forms of reproductive technology such as IVF and other ICSI, they are very expensive technologies. So this being source of challenge when it comes to management. But there's one common thing that we can all do something about, which is ignorance. Most people are totally ignorant of what fibroids are. They don't know when to take symptoms or even go to hospital. And even when we go to hospital early, in most cases where you are bleeding, you may require the blood level or HB is so low. Another challenge we face the inability of blood and other blood products that normally give when treating. Even in emergency cases, fibroids hardly prevent with very dire emergencies. A place where you are bleeding and it's very bad, there are other issues that come to play. We all know the challenge we have in this country about ambulance. And in some cases, even our cultural practices, impediment, there are certain beliefs that we have, even our religious beliefs. With all due respect, our friends are Jehovah's Witness will say no to blood. And that also, somebody needing blood, HB very low, and still saying no, brings a big challenge to all of us. And our cultural practices too, and also on religion. Some people may probably be having fibroids and they will still stick to prayers. Yeah, believing God to cause a miracle. Well, God is going to work that miracle through that health professional. You go to you don't, when you need money or need of money, you don't just pray and money comes. You pray and still write applications and set around. And through your boss, God works miracle and gets your money and the work you so need. Other issues mentioned earlier are the challenges of the availability of certain technologies. And in the management of fibroids, which I would mention briefly, when it comes to management of fibroids, okay, what we have, we have forms of management. The first type, what we have non-pharmacological management. Non-pharmacological management, we are not using drug, pharmacists to say in the management. And this, in some cases, when it's not causing any worry, you don't do anything to the fibroids. If you are having fibroids, but you're not bleeding, you're not having issues with fertility, you're not having pain, there might not be a need. If it's not deforming your body, doctor is so big, and you are so cosmetically worried and causing depression, you may not be so worried about fibroids. So you may not have to do every fibroid that we touch. There is none that you know. And there's a place for medications. When it comes to medications, mostly the purpose that the medicines is managing of complications and symptoms. For instance, if somebody bleeding excessively, you can throw in some drugs to reduce the bleeding or stop the bleeding. If you're having pain, then you need to give medicine. Cases where the fibroid is so huge, you may have to give some medicine to it, but it doesn't melt. Often what we mistake for melting our blood, which has probably clotted for some time before falling off from the vagina. And then when it comes to surgeries, there's a place for surgery, which we all know of. There are forms of surgery. One is to conserve the uterus, where you take off all the fibroid nodules from myomectomy and leave the futures behind. This is indicated in people who have fertility. If you have fibroids, but you still hope to give birth, there will not be a need for you to take out your uterus. So we may probably stick to getting the uterus out doing surgery and then take off all the fibroid nodules, reconstruct, so to say, and leave the uterus behind. Because the person has fertility wish. We normally take the uterus out, what we call hysterectomy, for people who are about 40 or 45 years. About 45 years, you are either having menopause or approaching menopause. There may not be a need for your uterus. The other advantage is once the uterus is out, your chance of getting cancer of the uterus is also eliminated. But for people who probably even with advanced age still have fertility wish, we still leave the uterus behind because there may be a place for assisted reproductive technologies like the IVF, the ICSI, and all that. That said, there are also newer technologies for treatment of fibroids. Typically among these is the use of umbilical artery embolization, okay, where we sort of block the blood flow to the uterus. Okay, so such fibroid nodules get deprived of the blood supply and eventually die. So I would like to briefly touch on the remedies to these social challenges, financial challenges, and other challenges that we encounter in the treatment of uterine fibroids. Typically, we may have to reconsider reforming policies when it comes to HIS for the National Health Insurance, fully cover the total cost of surgery plus other treatments. Medicines can be very expensive. Also, we'll have to invest in women. Once we invest in women's health, also empower women, we know they will be taking the right decision. Place for early education, women. If we act more of such forums or probably community engagement where women are aware of their rights and also aware of their health issues, they will take proactive steps to do the screening and prevent. It helps early detection and also prevention as well. And the political will, the government will have to be very committed towards this. Everything starts and ends with political will. Once the will of leadership is there, we'll see magic in that area. That said, there's a place for civil society organizations, also political groups that can give pressure, and also write articles and lead to lobbying and all that. That can help end up helping treatment and also prevention of uterine fibroids as well. Despite we still being in the year 2025, we are still faced with a lot of challenges affecting women, from obstetric fistulas to rape issues to issues of fibroid that we are discussing today to issues of fertility, a whole number of challenges. But we think I strongly think women are much more deserving. Yeah, even in we all know behind every successful woman is a man. Also, even the Quran for we Muslims, there's a whole chapter dedicated to women. Women are military men. We know we believe their civilian wives are even a rank almost ahead of. And then I dare to say that if you're a married man, the more you grow, as you go, you realize you are even tempted to believe that if you say the Lord's Prayer, there's the part of the Lord's Prayer that says, forgive us our trespasses, as forgive those who trespass against. That's probably to be said to even women because you have to be forgiven by their sins. So women play a very important role. They are a source of life. The least we can do is to make sure we secure their health, make sure the health is accessible and also quality. This is not going to come easily. It's going to be a very big Herculean tax, but we should all be committed to this. Like Obama said, there's nothing so satisfying to the spirit and describing of our character and giving our all to a difficult task. And in this struggle, we are all together. Thank you very much.
Oh, please, you can do better for him. That was brilliantly digested medically. I'm sure a lot of us, or some of us, were confused about the terms fistula, uterine, and even the term fibroids. But let me take this opportunity to remind you that we are live on Pan-African television. We're also live on Facebook. And to also welcome our sisters from the Traffic Hawkers Association. Nice. Please let's give it up for them. Edamase say mo abejoine e wa ha say yendi san komo we na medwen hu say de na dog ka nyina me kra say potokasa no me ye yi kakra wom ne kra na say ya yi ana hunza enti de na dog ke pa tra ne say fibroid no edi manya na wo say ye hwe ne yetu ho anamo e na obobo eniema bi a ye ya e de fibroid no brain nti wo hye we didie mu eto de bi ebetimi awo we busua mu eto de bi nso a ntimi hu bebi a efiri ba nti e wo ho a wo se ye boy ye homoden ye hye ye didie mu ye hye ya pomodin hu ye na ye betimi enya apomodin e de aye adwuma a e wo se ye ema ye man ema ye ho ene ye busua patros ye ate ase de na doc kan ne bebrebe ni na ne tofa no nti yembo ye nsema doc one more time. But thank you for joining us, and we do appreciate your presence here today. We've been talking about the subject of fibroids in relation to healthcare as a right and not a privilege. And I would like to quickly, give us some housekeeping briefs. So the program started with a opening remark by our comrade Blaise Tulo, and we'll also proceed with other aspect presentations. And there's going to be a Q&A session where you get to ask your questions and the things that, bother you. We'll also, value your contributions and any concerns that you may have. And this is the Freedom Center. We welcome you once again. And there's a restroom located right behind you on the right. So if you feel pressed, you can just kindly walk there and ease yourself. Well, let's continue by, refreshing our minds on some facts. Some facts when it comes to fibroid. Fibroids. Doc, is it fibroid or fibroids? I'd like to. So it's in relation to the mass, the number of masses that are formed in your uterus. Fibroid. Okay. So what is the best collective term for that? Fibroids. Right, absolutely. Now let's refresh our minds on some facts. And global statistics on fibroids. Now, up to 70 to 80% of women will develop fibroids by the age of 50. I think Doc indicated those quotas. And so he indicated from 35 or 33. Up to 80%, right? Right, noted. Also, fibroids are the most common tumors found in women of reproductive age. We're also looking at about 1 in 4 women with fibroids will experience symptoms such as heavy bleeding, he made mention of that, pelvic pain, and pressure. Let me add 2 more. Says black women are 2 to 3 times more likely to develop fibroids than white women. And fibroids account for over 200,000 hysterectomies, right? Hysterectomies annually in the US alone. I mean, in the context of Ghana, we are yet to find out those figures, but these are very important facts that we should take note of. And with the issue of women being very important, I do not disagree with you at all. Women face numerous challenges, especially with our health. Including childbirth and a whole range of health issues. And so it is very important that we've gathered here today to share ideas, to seek expert opinions, and consolidate all that into a powerful capsule to impact us in the future and, in our various lives. But please, let's get ready for another aspect presentation. We're supposed to be hearing from Dr. Thomas Anaba, Member of Parliament for the Garu constituency, but he's here to join us. And so while we wait for him, I would like us to hear from Dr. Nilante Blankson. Please, let's give it up for him. As he also relates, please join me here. As he also, relates the subject to healthcare being a right and not a privilege.
Thank you. So my name is Nilante Blankson, and I'm a specialist in internal medicine and therapeutics, and I work at the Trust Hospital, Accra. So I was invited to talk about quality health as a right, not a privilege, by the socialist movement of Ghana. and the women's wing, and I'm honored to be here to talk about it. Okay, so one of the fundamental issues that should underpin every human society is the support that must be provided for every member of the society, whether rich or poor, whether recourse to age, sex, economic or social background, or physical or mental ability. And even our dogs, even our puppies, you see that when a weak puppy is born, the other dogs gather around it to support it. We also know the worth of, taking care of weaker members of the society, and we know that there are some very brilliant people who are born as physically challenged people who can really contribute to science and mankind. I was trying to remember his name. There was this physicist, and I think Uncle C reminded me, I think Professor Hawkins. Now this man is paralyzed from his neck right down to his toes, and yet he's a Nobel Peace Prize winner. He's tough. I mean, he's crazy. And you can imagine if such people have been left on their own to survive in an environment where there's a lot of competition. I mean, you'd never realize the potentials of such people if you leave them to survive on their own. Therefore, I think that there should be a system worked out where the weaker members of society are taken care of by the society. All right. So that is the point I'm trying to make. In the absence of this principle of each person being the brother's keeper, in the absence of the principle, there's no basis to call a society, because then what all would have is a collection of, feuding groups, everybody trying to survive, exploiting the other, and I wonder how a society will survive in such a state, It is a well-known fact that the conditions for survival of every human being is food, shelter, clothing, and good health. Food, shelter, food, housing, clothing, and good health. Today we are considering health, the quality and conditions for good health and the well-being of people. So any society that is going to have a lasting existence must foster a state of affairs where each person is the brother or sister's keeper. Yes, caring for one's health could be expensive, but at the same time, we also know that people have died just because of their inability to buy a simple painkiller or an antibiotic. So the options available to us, we should ask ourselves whether healthcare should be provided only based on the ability to pay, or should be provided principally on the basis of clinical need. Okay. And I'm sure if I threw the question out to all of us, I wonder how many people would vote against healthcare being a right. I mean, and indeed it has been. I mean, many times the society has proven that is the way it wants to go, and it is no surprise that at a point in time we implemented the National Health Insurance Scheme. So the National Health Insurance Scheme, what is it? It's a system under which citizens make contributions through various means, including direct premium payments, direct income taxes, as well as levies when we buy items on the market. I mean, if everybody is contributing that much, then there's really no reason why the availability of healthcare especially basic healthcare for the most common illnesses, should not cover every citizen of the country. So I checked the list of services covered by the National Health Insurance Scheme, and it's amazing. Only if it works. So some of the things listed under, I'll just run through them very, very quickly so that we have a bird's eye view. Some of the things listed under the National Health Insurance Scheme: malaria, acute respiratory tract infections like flu, cold, and all those. Diarrheal diseases, when you have diarrhea, running stomach, skin diseases, ulcers, hypertension, eye infections, rheumatism, anemia, intestinal disorders, acute ear infections, typhoid, dental caries, diabetes mellitus. And diabetes is a big thing these days. I mean, it's coming up, and the care for it is quite expensive. But it's supposed to be covered under the National Health Insurance Scheme. Sexually transmitted diseases, asthma, and others. Investigations also covered under the National Health Insurance Scheme includes X-rays. But we know that a lot of times we have to keep topping up or paying for these services. Ultrasound scans for general and specialist outpatient services, HIV, AIDS, and symptomatic treatment for their opportunistic infections, outpatient care, day surgical operations, including hernia. Hernia repairs are also covered under the National Health Insurance Scheme. Incision and drainage of abscesses, boils, lumps, and hemorrhoids, hemorrhoidectomy, piles, is all covered under the National Health Insurance Scheme. Some medications, namely the prescription medicines on the National Health Insurance Scheme medicines list, are also covered, and some traditional medicines as well. That's those that have been approved by the FDA, Food and Drugs Board, and prescribed by accredited medical and traditional medicine practitioners. So, I mean, the list keeps going on and on. Oral health, eye care services, visual cataract removal for those of us who are above 60, 70 years, maternity care, antenatal care, cesarean sections. Can you believe it? Cesarean sections are all covered. Yeah. So, I mean, if we could really get all these things to be covered effectively, that would be great. Now, according to the Ghana Statistical Services, Ghanaians earning less than 23 Ghana cedis per day, that is classified by the UN as living in extreme poverty, constitute 26% of the population. Whereas those considered as being in standard poverty, thus earning 38 Ghana cedis per day, constitute 49% of the population. So in effect, out of an estimated population of 35 million, over 26 million of us are considered poor or extremely poor. That is the current state of affairs. In spite of this, only 54% of the population are active members of the National Health Insurance Scheme. And we have to ask ourselves why. The sad situation is that out of this 54% available data from the Statistical Service indicates that the enrollment on the National Health Insurance Scheme by the rich and educated classes is 3 times that of those coming from poor homes. That's also, I don't understand why, because it must be educational. Because I don't understand why there's a scheme which is available for everybody, and those who need the scheme the most are the ones who are patronizing the scheme the least. It is a sad but funny state that even the official minimum wage in Ghana is 20 Ghana cedis per day, which is below the level classified as extreme poverty. That was just a throw in. So health education and preventive health care. The availability of quality and widespread health education could be one of the cheapest ways to provide health care. Although there are certain health conditions that cannot be prevented for various reasons, example, age-related illnesses or genetic conditions, or maybe even fibroids to some extent. Numerous other health conditions that we face today depend on what we eat or how we process them, and our environmental conditions, etc. Such issues could be addressed through massive public education. Yes, we've been told that in Nkrumah's time, there were all these vehicles belonging to the Ministry of Information, vans and rovers that would mount public address systems and be going around and educating people on health and other social stuff. These days, however, the Ministry of Information is more or less a propaganda department for ruling governments and parties. I mean, show me one Ministry of Health educational skit that has been put on TikTok or YouTube or any of those places that we always go to that has gone viral. We haven't even put a real effort into it, you know, and we are really losing out on that. Do you remember all those public health jingles that we used to hear when we were younger on TV? I mean, it's the same thing. Education, education, education. So, although it is claimed that the National Health Insurance Scheme covers free medical care for 95% of most common health conditions in Ghana, the delineation of the free aspect is confusing and haphazard. A few examples are these. Although it is claimed that outpatient services are part of the free healthcare system, we all know that diagnostic investigations such as tests, x-rays, ultrasounds are all routinely paid for by patients. There are widespread cases where patients are expected to purchase medications prescribed by hospital doctors. There are also several cases where babies, mothers, etc. are detained in hospitals because they are unable to pay for their maternity services. Some women are made to pay for surgeries on fibroids or to pay for aspects concerning the management of fibroids, even though it's supposed to be covered under the National Health Insurance Scheme as well. Even in cases where services are officially listed as covered, appliances used in performing simple procedures are chargeable. Above all, free NHS includes dialysis and cancer treatments. Dialysis and cancer treatment. And dialysis is a very expensive, these are very expensive, very, very expensive projects. People sell their houses just to have dialysis treatment. And it's supposed to be covered under the National Health Insurance Scheme. Charlie, before wake up. So there are more questions than answers, finally. What purpose does it serve to claim to build more hospitals when people cannot pay for their hospital bills? What purpose does it serve to claim to build hospitals when you cannot employ adequate hospital staff to provide appropriate care? What purpose does it serve to claim to build more hospitals when these hospitals do not have equipment to meet the required needs? Why can't medical services be comprehensive, from preventive care up to surgery? How can anyone claim to reduce health inequality when they cannot ensure equal access for everyone, regardless of their income? How can we describe ourselves as an equitable society if sick people have to die because they are too poor to pay for their medical care and medication? If we all pay for health services through taxes, why can't everyone, especially those on low income, benefit from it without paying anything extra once they attend hospital. Food for thought. Thank you.
That was a powerful ending. Please give it up for him once again. Doc, thank you so much for advancing the conversation with regards to the economic dynamics when it comes to healthcare and the factors that sort of impede us from accessing healthcare and getting the quality healthcare that we deserve. And to think that fibroid, as common as it is among women, is not under the scheme is mind-blowing. It's mind-blowing. We need to talk about it. We need to make noise about it. And I'm very much interested also in the point you made about, stakeholders and the government's lagging efforts in promoting health. Those days when we're young, once you turn on your TV, you're hearing, we have vitamin A. How many of you hear that one? We have vitamin A. Ayele, let's go together. Okay. Together we give you good vision and help your children have a normal growth. We have glutathic acid, converging foods to energy, all these things, and it's been imprinted in our minds. And I'll tell you for a fact that these advertisements and televised content sort of helped me pass some exams because my background is in science. So now you're sitting there, they are asking you what are some of the nutritional values in vitamin A. What do you get in contomere? You get vitamin A. Now, it averts your mind to all those things. So it's very, very important that we take cognizance of that. So please let's give it up for Doc again. And let me just hammer on the fact that we are gathered here to gain insight. As much as we are here to gain insight, we are also here to, solidarize and advocate, create awareness, and take action because we are all at stake. And I'm very happy to see the men here. I was expecting just women. Please, all the men, give us a wave. Thank you so much for coming here to solidarize with us. And you are part of our growth. We can't do anything without you. The word woman is a combination of woo and men, or woo and man. So we just can't do it without you. So thank you very much. Now, we were expecting our third guest, our third speaker, but he's not here yet. And so I think we'll move straight to questions. I suppose we have questions or things that bother us. To our Traffic Hawkers Association, Pachopin Cabrofa na Minkatri. Minkatri Kakra. Okay. And doc na or the assembly to just say a bano NHIS na yemfa say a kwa e was say or mo e register on NHIS no mo kra na mo nka ho kra o mo e o mbetimi etua o mo apomoden hwe ene de ekeka ho no o mo na o mo NHIS no so kese enti ya ye ndimi ntua na ade ntia na ye register on the NHIS e ade e wo say ye dwen ho na ye hwe ne tu ho anamo pacho mo ne ye ya adwen okay ene yapon ana. All right, so we'll be taking questions, and so if you have a question, kindly, I don't know if we can form a line in the middle here. So just like it's done, or how is it going to be? Our camera, did she just come forward? Okay. Okay, the setup is underway. But let me remind you again that we are live on Pan-African Television, our trusted media partners, and also we are live on Facebook. And so please share the link. Hana say wadam fubi ana webusu ni bi ofia me pacho sending a message say we're live on Pan-African TV. So Facebook so call o share link na nsabe kan we ni bi ahwe na wesua ade efrim. Enti so we'll be taking our questions. So please, if you have a question, kindly come behind this mic stand. We take the questions and our experts will answer the question. Doc.
Sorry, I have a question, but I'd just like to know roughly how many of us are really registered on the National Health Insurance Scheme. Can you just show us by raise of hand? So you're actually in the minority. All right, thank you.
Can you imagine? I'm advocating, but I'm not on it. I used to be on NHIS. I don't know what happened. So, yes, I think the question still remains as to why for someone who used to be on the scheme and now why. Perhaps it's because I wasn't falling sick often, wasn't visiting the hospital, or perhaps I thought I could afford whatever service I was receiving from the hospital. But that is not even a founded reason. I need to register, right? So please, if you have any question, please come behind the mic and we'll pen it down for our experts to answer. Any questions? Okay, I see Loretta coming. Please, you can just form a queue. So once one person asks the question, we just write it down. You take your seat and you take turns until the queue is exhausted. Thank you. Please, you mention your name and you ask the question. Please speak into the mic, let's see. No.
Okay, good evening. My name is Loretta, and so just not even up to a year, I went through surgery, fibroids. It's also an issue that's very dear to my heart. And I saw the masses, the fibroids that were taken out of me, and I think about it, and I'm wondering what kind of medication can melt this, actually. Because on radio, on TV, in the media, it's always this kind of local medication can melt it. And so a lot of women tend to patronize those medication. And I don't know if there is a success story, so maybe I would like you to touch on herbal medicine and fibroids. Also, to Dr. Blankson, with the health insurance, usually I think that the reason some people are not on, maybe for me, it's usually for the public hospitals. And aside the long queue and the treatments that we get, sometimes we opt for private hospitals. In the past, it could take care of some cost in the private hospital, but as time went on, I think everything collapsed, and now when you go to the private hospital, they don't even accept. So I think that is the reason most of us are not on, because we usually go to the private hospital. It's not the best, because there are facilities that when you go to the private hospital, you won't get. You usually have to go to the public hospital. But when you go to the public hospital, sometimes it's how the nurses will treat you, the long queue. When you are going for a checkup, it means that you have to miss a whole day or 2 days of work before you get a doctor to see you. So I think that we would have to improve on our services. It is a good thing, but that is the reason I think that I am not on it. I don't know for others. Thank you.
Thank you very much, Loretta, for that question. Yes. Please, has it been fixed, please? Okay. So please stand behind the... Oh, you can... Pachong beti mi aba. Mbacho won sembi sebia na bibia echiro wajo inswa. Misrel, munye kiu wa hase. Na obi bisa na watu aso bisa. Ebe choro nini na ewia enimdifono ede imwaye amaye. Pacho ubebo udin. O me pacho ai. I'm saying Mike no still enye jumanti pacho or eye jumanti kasegum. Is be able to hold it? Okay, so while that is being checked, please do well to share the link on Facebook. We're also live on Pan African Television. Thank you.
But I'm person maybe says I didn't know common. Adrian is same one and say because I'm so white in a common. It's or throw more light on that. Thank you very much. God bless you.
Thank you, Pache Dase.
Good evening. Mpache from me root coffee. Na mi bisa fibroid makoye be 1 year ni. Na mi ko free honom no. Doctor ni explain nyama bebre kire me ba mi bisa say edro bi ani ho a e be stop na entimi embe bi omu ana. Mi question no.
Pache from me Prisla. Na mi bisa doc kasa no say a clot of blood. Ti my question is so be menstruate na a more clotter. A bit my symptoms say or fibroid na.
Madam Wasi, but your friend me Francis Asumedu, me traffic hawker. But your question is say, you know no man, ya no mofu, e bi efususu. Na mi busa say a fibroid, and I'm gonna say na say a yard for fro. Madam Wasi.
Pache Dase.
Good evening. Doc Pachum Pese me bisa say ebi obi terminate abortion, but
Baby, dog doesn't understand tree. Can we speak English? I mean, what's...
Okay, when I finish, I'll
Okay.
say it in English.
Okay, thank you.
Say obi terminate abortion. Obi pese o yugu, but shut down anye obi tmenya fibroid ana. My next question. Say doc o kasa no ka say obi pese owa mo betimi ayi fibroid na free ho. What are the chances say obetimi conceive? My next question say ebia nipa no we hu ni ye say fibroid bi wo ho and our conceive ye. Ti ye be dey manage the two, the fibroid with the pregnancy. And no question ni e ba course na ne boye den. Whether drugs and I say surgery no. Into alternative medicine and as alternative treatment bi wo ho ana. Me person bisa say ade na omo koye surgery no munya a lot of complications obeti yes will be a frame e come be na ya na ni pass through say or take class when you fibroid on pese like what the betu ni team say na akofa prayers and I say that methods me auntie ne ho ye den but call hospital on one case on an anti call hospital but call omo ye surgery no bleed ye na no one no wa me fi bim nti how will I made them catch and I say me too be for say also call hospital for surgery. Okay, so I will take it in English. So doc, please, I would like to you do that for me. Thank you very much.
Yeah, good evening. What's your friend Belinda do a back pay? Belinda, I do a back pay. Bisan say
tituru ya ma no bebre wo ho wa 1 2 wo pese wo pause kakra na wa go through farming planning scheme no. Na before na wan ko ho no na wo menses no eba 5 to 7 days no all right, but wa ko eno so aba no na etwetwe si ebi wo emba fully ebi wo 2-3 days na etwa ebi wo bebre emba bebre okwa necessary normal ba ye ankasa ye wa abonte no according to yan community ye see fibroid ebi wo emba kra pese mi hu se no kra se wo ko oho se ko protect ho obetimi anya sa fibroid no wo ana. Thank you.
Hello. My name is Frank. My question is that, you see, when HIV/AIDS came, I think they started a campaign about how we can prevent HIV. Even became part of the item they sent to hospitals as a, what do you call it, the family planning materials, which are not chargeable by the state. So the thing is that it's to help prevent pregnancy and also HIV/AIDS. Why is it that there is no preventive measurement, also campaign issues about this fibroid thing? Because fibroids always starts when women start menstruating. You are prone to get fibroid. So if there are ways, measurement ways or preventive ways, or even campaigns about how to prevent fibroids, and also to educate women that getting fibroid doesn't mean that's the end of your life. There is more life after fibroid. So you can also, it's curable, and also that educative part of it. My question is to the Ghana Medical and Dental Association. The question is that, why are they so quiet about it? For example, this Communalator talk about the Ghana Health Service, NHIS not working at the private hospital. At first, it was working, but then the government was not paying them. So the private hospital association
complaint says about 3 months, 4 months with an menstruation here. If I say 18 to 20 years. Inti eba ne sana no ye pedro man no na woman na aba na sa cut off. Inti bit ma say fibroid na man no sa nsusu aso na say de. Damase.
My name is Ben Asamani. First, I want to ask a question. The medical, the free, is it free, or when you are going, is it free? When you are going to register, do you have to pay? Okay, that's the problem. I visited just last week, so this fits in very well for me. And I have this card in my hand. I wake up one day last week, and I found some rashes on me. And then I feel pain on my neck. So my sister said, you better go to hospital. I don't like going to hospital. I prefer always, if I can get some, how do you call it? The local, I believe in that. Herbert, So I went to this hospital at Lego University. And then they asked me, do you have a card? And I said, no. So this card, I paid 200 Ghana cedi for it. Okay. Then I went through all the process, and I have to go to the lab. And they took 4 lab samples. And I have to pay 1,400. This is last week. And then I asked myself, okay, maybe I can afford it. But somebody cannot afford this. So this is where the problem is. Okay, I am a socialist. If you look at UK, it's the Labour government that came up with the National Health Service. That is free. Free. And though when you are working, you pay tax. The one who is not working also benefit from it. You understand? So I think while we're trying to see how best we can improve our medical, and the title of the whole thing is it right or privilege? You see?
It's a right and not a privilege.
It's the right, yeah, that's it. So for me, about a few months ago, I have a problem with my eye, my right eye. I went to surgery, free. Okay, because
Under the NHS.
yeah,
The British.
yes, over there. Either you are working or not, they care for you. And I think we should push this so that everyone can be able to have access to all this basic medical assistance. Another thing I want to say, we can prevent most of all these diseases or sicknesses by we get proper education of what we eat and what we drink. And I think the doctors might probably know better than what I'm trying to say. For example, in Ghana today, you find most of our people queuing for Indomie. You see, which have nothing to benefit the body. We live in our good, what do you call it? The contemporary, and the green, You see, and everything. Water is good. Some people don't even know the importance of water. So we have to educate our people. As we said years ago, education is there. We must go back to those things so that we know how. Sometimes I see people in Ghana with this sunshine, 3-piece suit, and I ask, is it okay? You see, because you see, we have to know the benefit of sunshine. We don't know the benefit of water. And everything that, I can go on, but I think the doctors know better.
Thank you very much. Thank you very much, sir. Great recommendations. And also, I think there was no question. Your question was answered. So the follow-ups were recommendations. Absolutely.
Yes.
Thank you.
Yes, my name is Sayura Mfiakaya. I think that listening to the doctors, it's obvious that these treatments are very expensive. From, if it's not fibroid, there's that and there's this and there's that. And I keep wondering, how can we, ordinary people who cannot even afford food, be battling with illnesses upon illnesses, and then we can't even afford? And I'm wondering, what are some of the things we can do so that we don't keep falling sick, and then we have to be at the mercy of healthcare, which is not even working well? And then lastly, the Chinese still have their Chinese medicine out there. Some way, somehow, as Africans, we've been here for a very long time, way before this kind of healing processes has come into being. This Western medicine has come into being. How were we existing, and what are the things we were doing before, now that everything has become all about orthodox medicine? That is, even the machines and medicines are all coming from the West that we have to afford. Looking at our country being a third world country where there's no money in the country. And yet, we are expecting that all these machines and all these facilities to be here and free like as it is in the West. Thank you.
Thank you.
Good evening. My name is Anthony Mensah with the Socialist Movement of Ghana. My interest in this topic is about the preventive aspect and the accessibility. We are aware in this country that a lot of people in the rural areas find it difficult to access medical treatment, especially women who are pregnant, etc., etc. So my question is, how can we make it possible, maybe by providing good rules and all those things, so women who are having challenges with such a thing can easily access this kind of medical centers? I know the current government is trying to put down cheap compounds. The previous government said it was going to put about 1111, Agenda 111, and nothing came out of it. So with this government in power, how can we do to make sure that people easily access this kind, especially pregnant women? The second one is about preventive. I think Dr. Sule made mention of something like the food that we eat and education. But it seems as if all these things are absent. So I want to find out whether this current leadership can generate those kind of things so that it can be prevented and we can easily get easy access to medical treatment.
Thank you very much. Thank you all for your questions and your recommendations, your submissions. So for the purposes of clarity, especially those who ask questions in the local dialect, let me just, so we have 14 questions and we're going to split it, so 7 each for each of our aspects. But some of them interplay, and so they'll just keep it short and simple. The first was asking about alternative medicine. That's Loretta's question. And why do people, that wasn't Loretta, it was someone else. Yeah. Why do people opt for alternative medicine as opposed to the clinical treatment and services? The second question has to do with, the prevalence of fibroid among Black women and why that is so. And the third question had to do with medication to eliminate fibroids. So is there any medication of a sort or any treatment of a sort that could bring fibroids to the barest minimum or to the minimum extent? The fourth one has to do with does clot of blood translate to fibroids? That's if you see heavy clots of blood during menstruation, does it translate as having fibroids? Or should you be suspicious in that regard? The fifth one has to do with abdomen protrusion. And if it's indicative of fibroids, my brother was asked to say, does it mean, do you say the breast or the stomach? Or say stomach, yeah. So does it mean they have fibroids? Okay, our doctors are going to answer that. We're also looking at, can incomplete abortion cause fibroids in terms of pregnancy termination? Also, what is the assurance to, like the return to fertility? If you have been operated on before, what is the guarantee that you can quickly return to fertility after your operation or surgery? Also, alternative treatment for fibroids, and if they are the best. And we're looking at question 9. It says fear of accessing treatment due to accounts of other people's experiences, i.e. deaths and other complications. So the fears that people's experiences sort of pose on other people just because they had some complications or they died. We're also looking at family planning dynamics and its relation to fibroids. So the myths and misconceptions that surround having been administered any family planning method and you experiencing some inconsistencies with your menstruation and whether or not it's indicative of fibroid. Now, we're also looking at low or no campaigns about fibroids and why are stakeholders and people at the helm of affairs quiet when it comes to, and also our policymakers quiet when it comes to campaigning for fibroids. Last 3 says, can menstrual inconsistencies translate to fibroids, which is in relation to one of the questions I just asked. And the third one is preventive measures for health conditions and also free healthcare. So what do we do to prevent such conditions? And also the issue of free healthcare. What is the government doing or what are stakeholders doing to ensure that people who are unable to access free healthcare get the opportunity as they deserve? Finally, the question was about how to make it possible this question, I'm not sure if it has to go to our doctors. I think it has to go straight to the government because we are asking about how they are going to ensure good roads to help people in the remote areas access good health care. But I pray that our doctors and experts will have something to say about that. And also the preventive measures in staying healthy and ensuring our total health well-being. We have one last question, and then we turn to our doctors for some answers.
My name is Genevieve, and my question is not in relation to fibroid. My question is in relation to cysts.
Okay.
Yes. What causes that, and how can we prevent cysts? And I want to know if there's another alternative aside surgery for umbilical hernia.
Okay. Umbilical. Okay. Please, have you gotten that? Are you ready for answers?
Hello. Thank you very much for that. I was discussing with Dr. Nee. I think because of our various backgrounds, all medical doctors, we agreed that he would take the social advocacy as questions. I would. Hello? Okay. I will answer the medical, the clinical questions. That's medical, pure medical. Take care of the social advocacy, HIS, and other questions. The first question got to do with whether herbal medications would melt fibroids, noodles. As of now, there isn't any medicine that melts uterine fibroid. That's established. Okay, and both herbal or Western medicine. What we have are medicines that can shrink. Okay, it doesn't really melt as in melting, like how we have shea butter melting when subjected to the heat of the sun. It doesn't melt. Contrary to that, it can rather, shrink. There are medicines, GnRH analogs, very expensive medicines that can make it shrink. So these are medicines that some to give when preparing somebody for surgery. When a fibroid nodule is so huge, your risk of bleeding is very high. You're likely to give this medicine and wait for some weeks or days for it to shrink to make it easily operable and to reduce your chance of bleeding excessively. That said, there is not medicine that's going to totally eliminate. Yeah, by shrinking it, it reduces the risk of excessive bleeding and other symptoms that comes with compression and all those things. The second question got to do with why is it so common in blacks, people of African origin? Not just people of African origin, but even African Americans, that's black Americans. So it's been established that there's a genetic component to it. Okay, so people who have certain genes, it's common in blacks, they tend to have more uterine fibrosis occurring. That's why blacks. Secondly, we also realized, per our studies, blacks are more likely to suffer obesity compared to the whites, the Caucasians. Even in America, the black Americans look huge, bigger than the whites. What we find from our studies is that people who have a lot of fat in the fat tissues, the conversion of some of these hormones, peripheral conversion into these human hormones, estrogens, and these hormones probably serves as food or probably encourage the growth of the uterine fibroids. So for somebody who is huge or obese, the risk is higher. Since we have more blacks coming out with obesity, for instance, reason that blacks are at higher risk. The third issue also got to do with we don't frequent hospitals. We don't take these preventive measures. So, like our father saying from the US, UK, a lot of people go frequently for medical checkups. So a black woman will hardly come. So only present at the time when the uterine fibroids are huge. So that makes it easier. Somebody who is probably of other parts of the world may not be doing this. They pick it early and probably find a way of eliminating. The next question got to do with post-surgery, whether there is a medication that can prevent recurrence. There isn't a medicine that can prevent recurrence of fibroids. So, and the fact that you've any disease at all under the sun, once you've had it before, the fact that you've had it enough alone means there's a risk of you getting it again. And contrary to other beliefs, it's not like uterine fibroid where one particular organ, where you go and take out the fibroid and it vanishes. If your head were to be your uterus, you can assume fibroids to be, let's say, balls or pimples that come off. If it comes at this part of your head, let's say your forehead, and it's eliminated, once your head is still with you, it may appear at the back of the head. So it's not a recurrence of what you remove, but a growth in other cell. So it can be one part of the uterus now taking off that part comes, it only doesn't recur where you go and take off the uterus. My sister used a certain medical term, hysterectomy, that's taking off the uterus. So once the uterus is taken out, it will not recur. But once the uterus is there, if you go and do myomectomy, you remove the nodules from one part, that part, nodule can grow from another part. So taking medicine to prevent, there isn't of any medicine. Other measures like from what we know now, if you know you are obese, try and check. It raises the risk of probably you getting uterine fibroids. If you know the kind of food you eat, cut down with the fat and the carbohydrate food. Do checkups more frequent. If there are other issues that we know of, try and, like we said, staying off for a long time without getting pregnant. So all these things are ways that you can probably prevent it. So you try and get pregnant as soon as possible. That's your fertility wish. Once you haven't gotten to your age of menopause, where the bleeding has stopped, if you have fertility wish, you have to try and get pregnant as soon as possible. That's one of the preventing measures. That said, and because of the involvement of estrogen, once you get to menopause, if you have uterine fibroids, they are likely to start shrinking because you don't get the estrogen that face it. Okay, that's the reason. This is also part of the reason why before menopause, you have people from 35 years to 40 and 48 being with the highest risks. But once you get to menopause, it shrinks. And somebody also mentioned for adolescents, once start bleeding, it's also saying the same reason. Before you start having your menarche or bleeding, the estrogen levels are low. So you hardly see very young women, maybe 11, 12, 13. It's not so uncommon for them to get uterine fibroids. Our next question got to do with heavy clots. If you are bleeding and you are seeing a lot of clots, it's a sign of uterine fibroids. It's not always a sign of uterine fibroids. If you are bleeding and seeing heavy clots, it only tells you are bleeding heavily. Okay? What happens is blood normally is supposed to be bright red, but once it gets exposed to the atmosphere, the oxygen converts the ion from 3, so that's the color. And this, once you are hitting huge clots, that means you bled a lot, but just that they get collected in your vagina, so to say, or some part of the reproductive organ, where they form huge clots before they fall off. So if you see huge clots coming, only tells you are bleeding heavily. It also doesn't mean the fibroid is melting. No. You see huge clots, mostly, may be a sign of fibroid, but not all the time. It could even be a medical condition, non-gynecological, causing blood issues. Hemophilia, blood not clotting, bleeding from anywhere, in your vagina. So once you are seeing, you have to be assessed by a medical doctor. Don't just conclude you have fibroids. Most cases for a woman in reproductive ages, it could be fibroid. It could even be cervical cancer or endometrial cancer, cancer of the uterus. But it's best just established in the hospital aspects. The other question got to do with failed termination of pregnancy, whether it predisposes you to an increased chance of getting uterine fibroids. There's no link, no established link between abortion and your chance of getting uterine fibroids, whether successful abortion or a failed attempt at terminating a pregnancy. And then the next question, somebody asks about the return to fertility. Okay, what happens with uterine fibroids? And it's not so clear, okay, but if you are unfortunate, end up having uterine fibroids, and the fibroid is the cause of your infertility by way of it's probably covering where the baby is supposed to sit after fertilization. Once the fibroid is taken off, your chance of fertility rather increases. Okay? It is also in such a way that it's blocking where the tube hangs. Once it's taken off, can help your chance of fertility increasing. But if it's always also at a position where each removal leads to the scarring of that place or play damage during the surgery, during the fault of the surgeon or not, that may rather, in some cases, even rather block the tube or even decrease your chances. So it's not a clear cut when it comes to return to fertility. But in most cases, an indication for taking uterine fibroids may rather include taking it off so that your chance of conception will be increased. Yeah. So that's not a clear-cut question. Then somebody asked about fibroids in pregnancy. It escaped you. What happens is, if you have uterine fibroids in pregnancy, it may not even affect the pregnancy, depending on where it is. Okay, if it's in the walls of the uterus, it may not affect the pregnancy. Just that you are likely to be having pain and some of bleeding during pregnancy, which may not be bleed from the baby, but be due to the fibroid. You may have some pain too. Probably you may bleed a little at times too when you are delivering. But if you have fibroids during pregnancy, you are not fortunate, and also happens to be in the endometrium, or where the lining or the middle part of uterus is where baby is supposed to lie. This comes with increased chances of you having loss of pregnancy. In most cases, people may end up having either difficulty getting pregnant, or if you get pregnant, your chance of losing the pregnancy may be high. But by and large, in most cases, fibroids can coexist peacefully with the pregnancy. In most cases, except when the fibroid is so huge, they are squeezing the baby, so baby may affect the growth of the baby. But in most cases, it can coexist. Also, there was a question about taking out uterine fibroids during pregnancy. During delivery of a child. This is something we call cesarean mammectomy, which is done. It's a fibroid I've done a number of times. So if you have a surgeon who is competent, just that he has to make sure takes care of possible risk. You have enough blood, just that, because once you are taking out during pregnancy, there's increased blood flow. So once you are attempting to perform a surgery, other than once you are planning to take out a uterine fibroid at a time when you are taking out a baby, expect that the fibroid is highly vascularized. Highly vascularized means there's a lot of blood going to the uterine fibroid. So for a person who is not pregnant, there's not so much blood. God has designed in such a way that during the 9 months of pregnancy, the proportion of blood that goes to the uterus increases. So for obvious reason, there's a baby there that needs blood also to feed on. So the uterus becomes huge. Also, a lot of blood in the muscles of the uterine fibroid. So for an attempt at taking out uterine fibroid during pregnancy or at the time of delivery, you should rest assured that the patient will bleed, or the risk of bleeding is higher than if the patient were not pregnant. So for such a surgery, the surgeon has to make sure he's well prepared. Just make sure there's enough blood, just in case the patient bleeds, there's a blood to replace. And then if you even go in and you realize, the uterine fibroid is such that if you don't take time, the risk of other issues damage, you just come out without touching, and you can do the fibroid surgery. But it's possible. And in most cases, we're able to do that. Just to make sure the patient is well prepared for that. Somebody asked about alternatives to fibroid. There are alternatives to fibroid treatment also. I didn't get the question well. Alternative medicine. The first one, already answered. Then there was a case, a genuine concern about fear of complications from surgery. People go for surgery and everything. So once you're supposed to go for fibroid surgery, you get scared. Don't want to. Yeah, that's a genuine concern. Yeah, but it must be established that, like I said, in most cases, we don't even want to touch the uterine fibroids. So once the doctor starts telling you you should take it off, that means it's that affecting you in a way. Either blocking your chance of getting pregnant, or probably making you suffer so much pain all the time, or probably bleeding excessively. Imagine a person bleeding each time you bleed so much, taking tablets, increase your blood level, going for transfusion every 2 months or so. You are, for lack of a better expression, more like a basket. You pour in the water or the blood, only to leak. So these are the indications. But for surgical complications, it's not always due to the fibroids. You can have complications from the fibroid surgery from bleeding. In some cases, it's from the anesthesia complication. The medicine that you'll be given that probably putting you to sleep or not feeling pain, the complications for that. There may even be complications after the surgery, like I mentioned in the example that I said. Probably after the surgery, your chance of blood formation in your leg, both sides. So you have what we call different thrombosis. That can also shoot, get dislodged, can kill. But by and large, I think whenever there's a need for surgery, it's probably because you need to do that. That's why the reason why earlier it's done, the better. Okay, just that surgery is also a form of trauma. So there should be adequate preparation. The body itself, make sure the body is able to withstand the kind of trauma that it will be subjected to. The other clinical question got to do with family planning causing fibroids. That is a myth, probably real thing. Hardly do family planning methods. Okay, family planning methods, that's methods that you institute to prevent pregnancy or to space your children cause uterine fibroid. That said, with the knowledge of how family planning pills work, especially those with the hormone, hormonal ones. Also acknowledge the pathogenesis of uterine fibroids. You know that hormones like estrogen increases, estrogen also increase the growth of fibroids. So there's a little chance that in terms of, especially the estrogen only preparations, increase your chance. But these are negligible chances that we mentioned. Very common. The other question, somebody the age of 18 to 20 years not having a menses for up to 3 or 4 months, whether fibroid is a cause. Fibroid is a possible cause, but in most cases, when it comes to the effect on your menstrual cycle, whether you bleed or not, fibroid rather causes the other way around. It rather makes you bleed more frequently. It makes you bleed excessively because it blocks the vessels and prevents the uterus from contracting. Fibroid is more likely to do the other way around because it may lie and probably increase the surface area of the uterus to bleeding. So you may bleed more, but it's possible to cause that. In most cases, when somebody is not in a reproductive period, there may be other causes. Very common one is, this is called amenorrhea, the lack of menses. A very common cause among women is what we call the PCOS, or polycystic ovarian syndrome. There may be also other medications that are causing that. At times, it's as simple as even your mood swings, or you being anxious, and all these things goes along to affect a part of the brain that affects your menstrual cycle. Even losing weight drastically or putting on weight drastically can affect your menses. A whole lot of things. The other clinical question, I think that the last one got to do with causes of cysts. I want to assume you're referring to ovarian cysts. Okay, ovarian cysts are fluid-filled substances around the egg. So that's the ovary. So what happens is, during your menses, you are likely to release the eggs. The big egg, which is from or the dominant follicle, once it's not ovulated. So that's what's washed off. But there are times when it doesn't get washed off and it starts growing, keeps growing. That's cancer. That's basically how forms of medications that can increase the risk. Yeah. Also asks about alternates for treatment like our hernia, size, surgery. Okay, hernias, whether umbilical hernia, femoral hernia, or inguinal hernia, which is a commonest, are due to weakness in the wall. Be a weakness in your abdominal wall. So for such things, there isn't any medication. The only way out is to probably go push out whichever part is, probably close that gap. So for hernia, surgical means, cases where it's not so big, if probably you take off the risk factors, as in constipation or probably shouting too much, even heavy objects or heavy weights. When you have constipation, you are able to, you have prostate issues, which reason prostate is predisposed to take off those things. But there isn't any medical treatment for medical as in taking medicine that will take care of the hernia. Yeah, you may have to wait to say. Thank you very much.
Thank you very much, Dr. Sule. Thank you. Nti mpacho mo amu bisa question wo twi mu no. Monya momo aya na say wo se echichi. Pacho nti the obisa a question about family planning. Say ebetimi ne fibroid edi nkitahudie bi ana. Enye no kre. Family planning the woman say I want chichemu no enro ne yede mamo no ana say methods na ye administer to nipa or person or chiche na woman. It vary from individuals. Inti you senya ebia o she IUD ebe ye wo ho no ana insatraye ana say yes insatraye de beba ohunam no enya sa na ebe ye me in ena medicine sisudua ahye wo nkran say ukọ hospital na ukọ je ayarehwe bia the doctor na say nurse ne beka cho na ne wo se wutie na wudi so why because wadan for na say wunua ono so enya different experience e bia based on bibia ewo ne nipedua mu nti enye necessarily say sa particular service no and this are insunsuanso na bro mepacho what ma say yes and nipa ono so bisa about say ema a ye fususu kakra sebe say a fibroid na mepacho eno de individual differences obi wo ho aye kese yo keke obi wo so na bia ye yare bia enye fibroid obi so wo ho na aye nyinsen nti eni say yebe judge omo Pachamati basi. And I think so bisu bisa question about say blood clots say ebia I think the blood clot question was from someone who may understand. I think say 18-year-old akolan OWSS ne menses ne etwetwesia. Doc, your response was to it could be other cause. Ebetimi aye bibi. Nti I mo call hospital na mko bisa doctor for nurses for ekwan betimi afaso de aboan. Pacho yati ase. All right. Since all that has been attended to, it's my privilege to welcome our other speaker who we've been waiting for. He's finally here. And he's in the person of Dr. Thomas Sanaba. He is the Member of Parliament for the Garu constituency. Please let's give him a round of applause and invite him to the podium to give us a legislator's perspective of health being a right and not a privilege. Please let's give it up for him one more time.
Coordinate with the coordinator here to prompt me when to come. But instead of calling me, he sent a text. And I was busy, I didn't hear the sound on my earpiece. So it's later on I saw it. So let me apologize. It's not my habit to go to events late. So if the apology is taken, I can start my speech. Thank you very much. I think you've had very good lectures. I came in and listened to one of the doctors responding to your questions. That was very beautiful. But as a lawmaker and a doctor as my background, I'll give you some little perspective of what I think is happening in Ghana, how women are suffering with fibroids and the rest, and what we should be doing. So if there's a chairman, I'll say, Mr. Chairman, comrades, distinguished guests, ladies and gentlemen, friends, and fellow advocates of justice, I bring you warm greetings from Parliament and Garu, the land where hope lives, where community strives, and yet, like many parts of our country, the struggle for equitable healthcare remains real and urgent. It is both an honor and a moral duty to stand before you this evening, not only as a member of Parliament, but also a medical doctor, a husband, a father, and a believer in simple truth that healthcare is not a privilege, but a right. And if anyone doubts that, just ask yourself, it never waits for your bank account to approve your fever. That is why healthcare is not a privilege. Whether you are rich or not, if you are getting malaria, you get malaria. And you need healthcare to save yourself. I thank the women's wing of the Accra Collective of the Socialist Movement of Ghana for this invitation, and more importantly, for organizing this critical and necessary conversation that focus on fibroid and gender-specific health issue. It reminds us that when we talk about health, we must do so with gender awareness, historical perspective, and also political agency. Let us begin with a truth we too often whisper to ourselves, but today we must proclaim it loud and without apology. Our healthcare system is slowly but steadily being sold to the highest bidder. If you don't have money, you don't get health. Hospitals are being turned into profit-driven enterprises. Doctors are being forced into the role of merchants, and patients are no longer seen as human beings indeed, but as clients or customers whose access to healthcare depend not on agency, but on purchasing power. This commodification of healthcare is not only morally indefensible, it is also deadly, because people will die if we turn healthcare into a commodity. Consider the woman in Garu who travels 60 kilometers along unpaved dusty roads, often in pain, just to access a simple ultrasound to diagnose a fibroid. Imagine a single mother in Nima who postpones life-saving fibroid surgery, not because she does not want to heal, but because the procedure costs more than her entire annual income. Think of the young nurse in Tamale, trained with a lot of skills and passionate, yet unable to save lives because there is no functioning diagnostic machines, nor essential supplies, or no appropriate equipment for her to work with. These are not just isolated cases or sad anecdotes. These are our mothers. These are our sisters. These are our daughters. And these are equally our friends. May I submit to us this evening that each delay in care, each unaffordable treatment, each equipment failure is not just a system error, it is a breach of our shared humanity. It is a society saying, your health depends on your wallet. Your life has a price tag. We cannot and we must not accept this as normal. Now, let us speak about fibroids. A word that is too many women in Ghana know intimately, painfully, and often silent. These benign but debilitating growth affect the physical, the emotional, and the economic well-being of millions. According to medical studies, nearly 8 out of 10 women in Ghana would develop fibroids at some point in time in their lives. Can you imagine? Nearly 8%, 8 out of 10 women would develop fibroids in their lifetime. Why can't we have a system to treat this thing urgently? This is not a marginal concern. It is a national health crisis hiding in pain and in sight. Yet, despite how widespread and life-threatening this condition is, fibroid remains shrouded in stigma, misinformation, and neglect. Many women endure heavy bleeding, chronic pain, infertility, and depression in silence, afraid to wake up, unsure of any option, or simply unable to afford the cost of a simple surgery. Until fibroids are treatable, the science exists, the doctors are trained, the solutions are known. What is missing is not the medical knowledge. What is missing is the courage of leadership. Universal access to health care and economic justice. We must ensure that no woman is made to suffer because she has a uterus, a biological reality she did not choose, but was born with it. It is neither fair nor just that the price of being a woman should include prolonged pain and preventable complications. We must ensure that no woman is made to suffer. I'm repeating the sentence, sorry. Let us be blunt. If fibroids were a male condition, let us be honest, there would have been a dedicated national fund, an emergency policy, wide media coverage every month. But because it affects women, especially poor working class women, we allow it to remain invisible. That is the truth, and it must change. The most important question we must ask ourselves today is this: what must we do to build a truly people-centered health system in Ghana? One that is not designed around profit, politics, privilege, but around people, their dignity, and their right to live a good health. I humbly submit to you, my friends here. First, we must confront and defeat this profit motive in public health care. Healthcare should never be designed to please shareholders. It must serve the people. We need to shift power from profit holders to caregivers, from boardrooms to commodities and in communities for people to get proper health care. Secondly, we must place women's health at the very heart of our national health policy. Not as a footnote. It shouldn't be a footnote. Not as an occasional campaign, but as a permanent prioritized agenda. If we want to build a just health system, we must begin with those who have been systematically underserved. And 3, we must act and act on multiple fronts. We must educate, we must organize, we must legislate. As a legislator, I will take it up. From menstrual health in our schools to reproductive justice in our clinics, from investing in community midwives to deploying medical drones in remote areas, we must leave no woman, no child in any community behind. Let me be clear. In Parliament, I will advocate for the expansion of the National Health Insurance Scheme to cover comprehensively women's health services, including screening, treatment, and recovery support for fibroids and other productive conditions. I will push for targeted investment in maternal and adolescent health and for more equitable distribution of resources across our regions. But let me also be honest, and let's be honest to ourselves. The real power for transforming does not solely rely on parliamentarians. It is found right here. It is found in this room like this, where citizens gather, where minds connect, where hearts move, and where movements are born. The movement must come from here to advocates for women's right in health delivery. The further the healthcare in Ghana must be co-authored by the people, not just by politicians, but by participation. That is the only path towards a system that heals with justice and serves with dignity. Healthcare should not be viewed merely as one sector among many. It must be viewed as a national statement of value. of priority and of human worth. When a nation guarantees quality health care to its people, it is making a bold declaration that you matter. Your life is worth protecting. Your pain is not invisible. Your health is not for sale. That is the Ghana we must fight for. Not the Ghana of VIP wards for the wealthy and plastic chairs at the emergency for the poor. Not a country where the healthcare access depends on who you are or what you can earn. We must fight for a Ghana where healthcare is dignified, universal for all of us, and free at the point of need. A Ghana where every citizen, from Accra to Garou, from Kokomlemle to Pandai, one can walk into a clinic or hospital and receive the care they deserve, not as a favor, but as a right. Because when healthcare becomes a statement, it reflects the soul of a nation. And I say to you, let ours be a nation that chooses compassion over profit and justice over convenience. The Ghana Medical Trust Fund Bill that was recently passed by Parliament into an act is an indication of a light at the end of the tunnel. However, this light would shine brighter when the free primary health care is brought to Parliament and passed, serve the people that we hear and long to serve. Finally, as someone who was trained in Cuba, a country with limited material resources but unwavering commitment to health equity, I have witnessed in firsthand what it is possible to do in a nation with no resources and excellent healthcare system. In Cuba, healthcare is not measured by the market value, but by moral responsibility. The experience taught me that what makes a system strong is not how rich it is, but how just the system is. Healthcare, my brothers and sisters, is not a favor. It is not a luxury. It is not a token of charity. It is a right. It is a human right. Let us rise and fight for justice. Raise your hand and say, healthcare for all. Healthcare for all. Healthcare for all. Healthcare for all. Thank you very much for the attention.
Thank you very much, Honorable, for articulately and passionately reiterating that healthcare is a right and not a privilege. Please let's give it up for him one more time. I mean, to think that the longevity of your life and the quality of your health is predicated on how much money you have is a bit nerve-wracking. To a larger extent, I think it's sickening. And so we are grateful that you have enlisted several commitments that you are yet to put forth in supporting women's health and also safeguarding our rights in healthcare. Thank you very much. Please let's give it up for him. And as he said, it's not just the duty of the politician or the parliamentarian, but we also have the duty to support, to advocate, to create awareness, and to put in the action. And so at this point, Doc was going to address some social-related questions, if you are right. So he will do that briefly, and then we touch down for today's public forum.
There was the question on why alternative medicine appears to have garnered a lot of patronage. And I'll attempt to answer that question. I think first of all, cost is one of the factors that is heavily considered when someone wants to access health. And in people's minds, traditional medicine may be cheaper, even though we see a lot of times in the hospitals that traditional healers can really burn your pocket, you know, and then you come last minute and then you expect that Kolebo will do magic. So that is one of the things, the cost. I think also the fact that the traditional healers, I don't know, for some reason they appear to have more room to advertise on television and all those cable, I don't know how to call themselves. But when you put them on, you see all these people advertising, and sometimes they make very scandalous statements. And with those of us in the orthodox medical sphere, sometimes we are very, very distraught. We are like, what's happening? People are making all sorts of statements and nobody's being held to book, you know. And since some of the political leaders are here, I think that is something they should also add, to the agenda. That people who make fraudulent statements within the health sector don't go scot-free, because this is life we are talking about. I think also that traditional medicine, it's closer to us. Our traditions are closer to us. So obviously, we would have an affinity towards moving towards a traditional or alternative medical setup, yes. But, okay, so that's it. But I'd like to ask a question before I sit. And that goes especially to the Member of Parliament, or the Honorable Member of Parliament. When I listen to politicians, a lot of times I get the impression that they know what the problems are. They all know. But when they get there, then something happens. And I don't know what that thing is. You know, on all our receipts, we go to shops, Shell shops, you see NHIS levy, NHIS this, you are paying NHIS this. Where does all the money go? And I think that we should pay more attention to the Auditor General's report when it comes to things like healthcare. And I think the punishments there should be very, very stringent. Extremely. If you touch healthcare money, the punishment should be very, very stringent. So, well, this time, it appears like one political party has the supreme majority. And that can be a blessing. If you want to do what the right thing is, you have the chance now to roll in all these things that you know will help the people. So please don't fail, because if you fail, you'll be worse off than the MPP. You'll be worse. I tell you, your condemnation will be crazy. So please, you have the majority now. Please do what you think you should do. Thank you very much.
Thank you very much, Doc. So that wasn't a question. It was a passionate appeal and also a sound caution, a very subtle caution. All right, so there was a question that came from the back, but because of time, I've been prompted for us to. And so if you do not mind, you could walk up to one of the doctors to get that clarified. Are we good? Thank you. All right, so all too soon, we'll have to wrap up here, but I believe that you have learned and you are taking home something very valuable, and you are going to be a singular advocate and also a champion for women's health, healthcare being a right and not a privilege. Please let's give it up for the organizers of this amazing, insightful, eye-opening, and forward-looking public forum. Comrade Kwesi Pratai, thank you for joining us. I know he hates it, he'll kill me. But anyway, to the Women's Wing, Accra Collective of the Socialist Movement of Ghana, thank you so much for this opportunity. And to our speakers, to Dr. Thomas Anaba, Member of Parliament for the Garu constituency, please let's give it up for him. Thank you for making time out of your busy schedule to be here. Also to Dr. Faisal Sule, who is the CEO for Ryan Medical Center. Please let's give it up for Dr. Faisal Sule. And to Dr. Nilante Blanksin as well. Please let's give it up for him. And to your good selves, please clap for yourselves for making time to be here to share. And also, thank you so much for making time to be here. And just so you know, this was live on Pan-African Television. Thank you to Pan-African Television for always being our trusted media source. And we're also live on Facebook. I am Ohima Echajikum, your servant for today. I hope I did a good job. Then clap for me. Okay, so at this point, I will invite Comrade Jessica Chidera to give us the vote of thanks, and then we can wrap things up, socialize, refresh ourselves, and X out of here. Jessica, if Comrade Jessica is around. Okay, she's coming. Please let's give it up for Jessica.
Friends, on behalf of the Women's Wing of Accra Collective Socialist Movement of Ghana, I stand before you filled with gratitude, hope, and renewed commitment. Today has not just been another gathering, it has been a moment of truth-telling, consciousness raising, collective dreaming. A Ghana and a world where healthcare is not for sale, not for profit, but a guaranteed right of the people. We extend our heartfelt appreciation and gratitude to all our speakers, Honorable Thomas Anaba, Dr. Ninante Blackson, and Dr. Faisal Sule, for taking time to be with us at today's program on healthcare as a right and not a privilege. We thank you for standing with us in the fight for the fundamental human rights to healthcare. Your passion and commitment to this case are beacons of hope in the struggle against capitalist exploitation. Our deepest gratitude to all those who participated in this event, our comrades and friends, the Traffic Hawkers Association, Anna's Memorial Hostel, Ghana Institute of Journalism, Accra Technical University, and many others. Thank you for being part of this revolutionary conversation. To all of those who took the microphone and spoke, your questions, your testimonies, and solidarity are what defines this moment. To the volunteer, organizer, and comrades of the Women's Wing of Accra Collective, who made it possible today, I salute you all. You are the beacon of this movement. And to the entire socialist movement of Ghana, your support and unwavering belief in the power of the grassroots women organizing gave us this space and strength to grow. Comrades, friends, brothers and sisters, let's keep the fire burning. Let's keep rising. Power to the people, health for all. Long live the struggle. Thank you all.
Thank you very much, Comrade Jessica. Let me also extend our heartfelt felicitations to our viewers, those who watched us live on Facebook and live on Pan-African Television. We are truly grateful. But let me leave you with a quote by an Asian philosopher, Hillel, as he says that if I am not for myself, who will be for me? But if I am also for just myself, then who am I? If not now, then when? If not now, when are we going to espouse the conversation of women's health and champion the cause of, having our rights not trampled upon? So it's been an amazing time with you all. I hope you've learned, and I hope you're taking something very valuable home. Thank you once again to our speakers, and thank you to you once again. It's been an honor. Good night.